Good evening, everyone. Thank you so much for being here today. You know, I want to start with a question that I'm sure many of you have thought about, but perhaps never really wanted to face. What would you do if someone next to you, maybe a family member, a friend, or even a stranger, suddenly collapsed from a heart attack? What would you do in those crucial first 5 minutes? That's what I want to talk to you about today, and I promise you, by the end of this speech, you'll feel more confident, more prepared, and frankly, more empowered to potentially save a life. Let me tell you something from my 23 years of practicing emergency medicine. I've seen countless people survive heart attacks because someone nearby knew exactly what to do in those critical first moments. I've also witnessed preventable tragedies because people froze, panicked, or simply didn't know the right sequence of actions to take. The difference between life and death in a heart attack scenario often comes down to those first 5 minutes, and that's the real heart of what I want to share with you today. Now, before we dive into the specifics, I want to emphasize something that I think gets lost in all the medical jargon and complicated terminology. Every single one of you has the potential to be a hero. You don't need to be a doctor. You don't need years of training. You just need to understand the basics, stay calm, and be willing to act. That's it. And today, I'm going to give you that knowledge. I'm going to walk you through exactly what needs to happen during those first 5 minutes when every second truly counts. Let's start with recognition, because you cannot help someone if you don't know they're having a heart attack. This is where so many people go wrong. They either don't recognize the signs, or the person having the heart attack themselves doesn't recognize what's happening. I've had patients tell me after surviving a heart attack that they thought they were having indigestion or anxiety, or maybe they'd slept wrong. One woman told me she thought she was just tired. These misconceptions cost us precious time, and time is the enemy in a cardiac event. The classic signs of a heart attack include chest pain or discomfort. Now, I want to be specific here because this matters. The pain can feel like pressure, squeezing, fullness, or tightness in the chest. It's often described as an elephant sitting on your chest. Some people feel it more on the left side, others describe it as central. The pain might last for more than a few minutes, or it might come and go. But here's the critical part. If someone is experiencing chest discomfort, we should treat it as a potential heart attack until proven otherwise. Beyond chest pain, there are other warning signs that I need you to know. Some people experience shortness of breath. This can happen with or without chest pain. I've had patients who came in complaining primarily about difficulty breathing, and it turned out they were having a heart attack. Others experience pain in their arms, neck, jaw, or back. Women, in particular, sometimes report different symptoms than men. They might feel nausea, extreme fatigue, or general malaise. They might experience discomfort in the upper body that's not specifically centered in the chest. Some people break out in a cold sweat. Some feel dizzy or lightheaded. Some experience unusual anxiety. The reason I'm spending time on recognition is because the moment you identify that someone might be having a heart attack, the clock starts ticking on those crucial 5 minutes, and that's when everything changes. So let's say you've recognized the signs. Someone near you is experiencing what you believe might be a heart attack. What is the very first thing you need to do? Call emergency services. This is number one. I cannot stress this enough. Do not delay. Do not wait to see if it gets better. Do not drive the person to the hospital yourself, though I understand the impulse. Call 911 or whatever emergency number is used in your area. Do this immediately. Get that ambulance dispatched. That's your first action, and it should take less than a minute. When you call, provide the dispatcher with clear information. Tell them someone is experiencing chest pain or symptoms that suggest a heart attack. Give them your location. Answer their questions. Some dispatchers will provide instructions over the phone. Listen to them. They're trained professionals, and they're coordinating the response to get help to you as quickly as possible. If you're alone with the victim and you're hesitant about making the call, remember this. It's far better to call for an ambulance that might not be needed than to delay calling for one that definitely is. Now, while you're waiting for the ambulance, and this is crucial, You need to keep the person calm and comfortable. Anxiety and panic actually make a heart attack worse. They increase the heart's workload, they elevate blood pressure, and they can increase the risk of dangerous arrhythmias. So your next action is to help the victim stay as calm as possible. Have them sit down or lie down. If they're comfortable, they can sit upright, slightly leaning back. Some people feel better lying flat on their back. Let them find a position that feels most comfortable and breathable for them. Here's something I tell everyone. If the person is conscious and able to chew, and if they're not allergic to aspirin, give them aspirin. Aspirin is one of the most important interventions you can provide in those first minutes. Aspirin works by inhibiting platelet aggregation, which helps prevent the clot from getting larger and further blocking blood flow to the heart muscle. The dose I recommend is 325 milligrams, which is a standard strength tablet, or 500 milligrams if that's what you have available. You can give them up to 4 tablets if needed. Have them chew it rather than swallow it whole, because chewing helps it get absorbed faster. If they have difficulty swallowing, chewing is actually better anyway. Now, if the person has contraindications to aspirin, such as a known allergy, or if they're currently on certain medications, skip this step. But for most people, aspirin in those first minutes can be genuinely life-saving. While they're taking the aspirin and you're waiting for the ambulance, monitor their vital signs as best you can. Check their pulse. Can you feel a pulse at the wrist or the neck? Are they breathing? What's their level of consciousness? Are they responsive to you? Talk to them. Keep communicating. Tell them help is on the way. Reassure them. Engage with them. This serves the dual purpose of keeping them calm while also helping you monitor their condition. Now, let me talk about something that a lot of people are afraid of, but that might become necessary: CPR. If the person becomes unresponsive and you cannot detect a pulse or breathing, you may need to start CPR. I know this sounds daunting. I know many people have never done CPR and they're scared they'll do it wrong. But let me tell you something from my experience. Doing something is infinitely better than doing nothing. An attempted CPR, even if imperfect, gives that person a chance. No CPR at all gives them almost no chance. If you find yourself needing to do CPR, here's what you do. First, ensure the person is on a firm, flat surface. Tilt their head back slightly to open the airway. Place the heel of one hand on the center of their chest, right between the nipples. Place your other hand on top. Keep your arms straight and use your body weight to do the compressions. Push hard and fast. The current recommendation is at least 100 to 120 compressions per minute. If you've ever heard the Bee Gees song "Stayin' Alive," that's actually the perfect tempo for chest compressions. The beat matches up perfectly with the recommended rate. You should compress the chest at least 2 inches deep, maybe up to 2.5 inches, depending on the person's size. Continue compressions until help arrives or until the person shows signs of life. If you're untrained and uncomfortable with rescue breathing, just focus on chest compressions. Hands-only CPR is increasingly recognized as highly effective, especially in the first few minutes of a cardiac event. But here's something else I want to mention, because I think it's important. If there's an automated external defibrillator, or AED, available, use it. Many public places now have AEDs mounted on walls. Schools, airports, shopping malls, office buildings, they increasingly have these devices. An AED is one of the most incredible tools in modern medicine. It's designed to be used by non-medical personnel. It talks you through what to do. All you have to do is turn it on and follow the voice prompts. It will tell you where to place the pads. It will analyze the heart rhythm. If a shock is needed, it will tell you to clear the area, and then it delivers the shock. If a shock isn't needed, it will tell you that too. But here's the key. The sooner an AED is used after the onset of cardiac arrest, the better the outcomes. It can mean the difference between full recovery and permanent disability or death. Now, I want to go back to something because I realize I haven't emphasized it enough. Time is muscle. When we say that in cardiology, we mean that the longer the heart muscle is deprived of oxygen, the more of that muscle dies. We have something called the golden hour in emergency medicine, but for a heart attack, I'd argue the first few minutes are even more critical. Every minute that passes without blood flow to the heart muscle means more damage. Every minute without intervention means more risk of complications like cardiogenic shock, where the heart simply can't pump effectively anymore, or lethal arrhythmias that the heart just can't recover from. This is why calling 911 immediately is so critical. This is why getting the person aspirin is important. This is why CPR and AEDs are so important if the person goes into cardiac arrest. All of these interventions buy time. They buy time for the ambulance to arrive. They buy time for professional medical help to reach the patient and provide advanced interventions like medications, defibrillation if needed, and transport to a hospital where they can receive specialized care like cardiac catheterization. Let me talk a bit about what happens after those critical first 5 minutes, because I think it helps to understand the larger context. When the paramedics arrive, they'll continue CPR if needed. They'll apply their own AED. They'll start IV lines. They'll administer medications. They'll get a 12-lead electrocardiogram, which is a detailed reading of the heart's electrical activity that can tell us exactly what's happening. They'll establish a clear picture of what's going on and communicate that to the receiving hospital. Many people having a heart attack due to a blocked coronary artery will need to go to a hospital equipped for emergency cardiac catheterization, also known as primary PCI or percutaneous coronary intervention. This is a procedure where doctors thread a catheter through the arteries and, under fluoroscopy, locate the blockage and place a stent to restore blood flow. This procedure is most effective when it happens as soon as possible after the onset of the attack. Some hospitals have a goal of getting patients to the catheterization lab within 90 minutes of arrival, or even faster. But all of this advanced intervention depends on one thing: someone recognized the problem, called for help immediately, and provided initial interventions in those first minutes. You are the link between the onset of the heart attack and professional medical care. You are the lifeline. Your knowledge and your actions in those first 5 minutes can quite literally determine whether someone lives or dies. I want to circle back and talk about prevention for a moment, because I think it's important context. While knowing what to do during a heart attack is critical, preventing a heart attack in the first place is ideal. The risk factors for heart disease are well known: smoking, high blood pressure, high cholesterol, diabetes, obesity, sedentary lifestyle, stress, poor diet, family history. If you have any of these risk factors, work with your doctor to minimize them. Take your medications as prescribed, get regular exercise, eat a heart-healthy diet, manage your stress, don't smoke. These are the foundations of prevention. But even people who do everything right can have a heart attack, particularly as they age. So even if you're doing everything to prevent it, you should still know what to do if it happens. Let me also mention something about the psychological aspect of a heart attack, because I think many people underestimate this. If you're the person experiencing a heart attack, the fear is enormous. The anxiety is real. The body is releasing stress hormones. The adrenaline is surging. Everything in you wants to panic. But panic makes everything worse. Panic increases the heart rate and the heart's workload, which is the opposite of what you need. It can trigger dangerous arrhythmias. If you're with someone who's having a heart attack, one of the most valuable things you can do is help them manage that psychological response. Stay calm yourself. Speak in a soothing voice. Provide reassurance. Let them know that help is coming. Let them know that they're not alone. This matters more than you might think. There's also something called the warning period that some heart attack patients experience. In the hours or even days before a full-blown heart attack, some people notice chest discomfort, shortness of breath, or unusual fatigue. This is your body's way of giving you a heads up. If you experience these symptoms, don't ignore them. Seek medical attention. Call your doctor. Go to an urgent care or emergency room. Don't wait for it to get worse. I've had patients who ignored these warning signs and ended up having a massive heart attack that could have been prevented if they'd sought care during that warning period. Now, let me talk about specific populations because heart attacks don't always present the same way in everyone. Women, as I mentioned, often have different symptoms than men. Women are more likely to report shortness of breath, jaw pain, back pain, nausea, and extreme fatigue. Women might not experience the classic crushing chest pain. This is why women are sometimes diagnosed later in their heart attack, or why they sometimes delay seeking care. They don't think what they're experiencing is a heart attack. Older adults might have atypical presentations, too. People with diabetes might have what we call silent ischemia, where they have significant blockages and even heart attacks without typical pain symptoms. This is why it's important for people in these groups to be particularly alert to any symptoms and to be proactive about their heart health. I want to address one more thing that I think is important: survivor's guilt and recovery. If you survive a heart attack, the journey doesn't end when you leave the hospital. There's often a significant psychological component to recovery. Many survivors experience fear, anxiety, depression. They're afraid of another heart attack. They're worried they can't do the things they used to do. They might have what we call post-traumatic stress responses. This is normal, and it's important to address it. There are cardiac rehabilitation programs that can help. There are counselors and therapists who specialize in helping heart attack survivors. And if you know someone who survived a heart attack, be supportive, be encouraging, help them as they navigate their recovery. The statistics on heart attacks are sobering. In the United States, someone has a heart attack roughly every 40 seconds. That's 90,000 a day. Every 11 seconds, someone dies from heart disease. These aren't abstract numbers. These are people. These are families. These are breadwinners and beloved community members. But here's what's encouraging. Survival rates have improved dramatically over the past few decades. With rapid recognition, early intervention, and modern medical care, more people than ever are surviving heart attacks and going on to lead full, productive lives. So, in summary, let me distill what I've talked about today into the essential points. First, know the signs of a heart attack: chest pain or discomfort, shortness of breath, pain in the arms or jaw or back, nausea, cold sweats, lightheadedness. Recognize these symptoms in yourself and others. Second, if you suspect a heart attack, call 911 immediately. Don't delay. Don't second-guess yourself. Call for professional help. Third, give aspirin if available and appropriate. Have the person chew it. Fourth, keep the person calm and comfortable while waiting for help. Fifth, if the person becomes unresponsive and you can't detect a pulse or breathing, start CPR or retrieve an AED if one is available. Sixth, continue CPR until help arrives or until the person shows signs of life. These simple steps, implemented quickly and decisively, can and do save lives every single day. I've spent my career in emergency medicine seeing the best and worst of human circumstances. I've seen people pull through against incredible odds, and I've seen tragedies that might have been prevented with just a little bit of knowledge and quick action. The knowledge I've shared with you today is powerful. It's the kind of knowledge that empowers you to be a lifesaver. I encourage you to take this information seriously. Share it with your family. Share it with your friends. Take a CPR course if you haven't already. Make sure you know where the AEDs are in your workplace or your community. Be that person who knows what to do when it matters most. And before I finish, I want to ask you to do something for me. If you found this information valuable, if you think it could help someone else, please subscribe to this channel. Subscribe so you get more content like this. Medical knowledge that could genuinely save lives deserves to be shared and heard. And please, leave a comment. Tell me what resonated with you. Tell me if you've ever been through a cardiac event or helped someone through one. Share your story. Tell me what you'd like to know more about. Your feedback helps me create content that's relevant and useful for you and for your community. Together, we can create a society that's more prepared, more knowledgeable, and more capable of responding to cardiac emergencies. Thank you for being here today. Thank you for caring enough to learn this information. And thank you for potentially being the person who saves a life someday. Stay healthy, stay informed, and stay ready.